Eritrea has an estimated 226,000 individuals with disabilities, with children accounting for 13.5% of this population. Unfortunately, children with disabilities face numerous challenges, including social stigma, limited access to specialized healthcare, mobility issues, environmental barriers, poverty, and a lack of social services.
Disability is a human rights issue, and therefore what we try to do is first and foremost that the communities, the families, and the persons with disabilities themselves are oriented on who they are. So persons with disability are human beings, and every human person is dignified. The rights and welfare of the person with disability, the children with disability, should be respected.
UNICEF has partnered with the government of the State of Eritrea to implement an integrated, community-based, inclusive development approach.
To include persons or children with disabilities in programming, the first thing should come, the barriers has to be removed. The environmental barrier, organizational barrier, attitudinal barrier, traditional, related to social stigma. All these barriers has to be removed in order to improve the accessibility of service for children with disabilities.
The primary objective is to enhance access to crucial social services such as healthcare, education, protection, and social welfare while fostering social inclusion.
This is what UNICEF is looking at. We don't see disability, we see individuals, we see potential people, we see people that are having impairments and that they can make contribution to the society. So we're doing everything we can to make sure that they are included in our services.
Yetna Beresh Nuguse, program specialist at UNICEF's Eastern and Southern Africa Regional Office, recently conducted a productive working visit to Asmara, Eritrea from the 14th to the 18th of August in 2023.
I'm so glad to see that the Eritrean government has still maintained a very strong commitment to the issue of disability. I have seen a very significant move towards systematizing the issue of persons with disabilities in the country, including children.
During her visit, she engaged in fruitful discussions on disability inclusion programs with various line ministries, including the Ministry of Labor and Social Welfare, the Ministry of Health, the Ministry of Education, and various associations, among which included the Eritrean National Association of the Blind, the Eritrean National Association of the Deaf, and the Eritrean National War Disabled Veterans Association.
We have at least 4 associations for persons with disability. We have the National Association for those with vision impairment, for those with hearing impairment, for those with intellectual developmental disability, and for those with different mobility disability. And they are very helpful not only in the promotional and preventive activities, but in the rehabilitation and the transformation of the livelihoods of the persons with disability.
Eritrea is one of the countries where we have community-based rehabilitation, and I should dare to say that this is the only country in this region where we have community-based rehabilitation fully funded by the government. So this is a clear sign of commitment, a demonstration of dedication for the topic.
The Community-Based Inclusive Development Program operates through a network of over 3,000 dedicated volunteers covering 80% of the country.
Eritrea is also a country where we can learn a lot of innovation, like Donkey for School program is something that we keep on sharing for other governments. So it's not a country that we are also building capacity, but it's also a country where we are learning quite a lot in terms of really ensuring the self-reliance of persons with disabilities.
UNICEF Eritrea also produces support to the Ararib National Orthopedic Workshop, which produces assistive orthopedic devices. Additionally, Yetna Beresh also had the opportunity to visit schools catering to children with diverse disabilities, gaining valuable insights into their experiences and needs.
It has been really a very rewarding spending time with children who are deaf, with children who have intellectual disabilities and developmental disabilities. It was above all very encouraging to hear how the government really wants to pace up the inclusion agenda both in the Ministry of Labour and Social Welfare, in the Ministry of Health, as well as in the Ministry of Education.
Recently, the government of Eritrea finalized and endorsed the National Disability Policy, marking a significant step forward.
Our main goal for 2023 is to ensure that the disability program in Eritrea is integrated, is to ensure to identify key areas that we need to support as UNICEF, especially now that we are developing our 2024-2026 work plan for our country program.
We are trying to promote awareness, to change the environment, to remove the environmental barriers, and then children with disabilities or persons with disabilities to have access as much as they want, because since that's a vital part of life.
Together, UNICEF and the government are working towards a more inclusive society that upholds the rights and social integration of children with disabilities in Eritrea.
For us, when we say UNICEF is for every child, it's not about how many the children are, but every individual child matters for us. So it's quite important that we work very closely with our partners, mainly government, to really ensure that we have an inclusive Eritrea which can serve every child regardless of their gender or disability. And I'm so glad to see that we are on the right track. We all need to do collaboratively, create the silos and build bridges to ensure that we complement each other in order to leave no one behind.